expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency. We are servicing Miami-Dade, Broward, and Palm Beach County. You can reach us directly at 954-717-7027. I am your host, Louise Gomez, and today I would like to welcome to the show Dr. Gil Lichtshein.
Yes.
Did I say that good? Okay, I'm calling
Close
you.
enough.
I'm calling you Dr. Gil from now on. And he is an adult and child psychiatrist. The phone number you can reach him at is 561-300-4052. And he's right here local, 7100 West Camino Rail, Suite 404, right here in Boca, 33433. Welcome to the show.
Thank you very much for having me.
Absolutely, absolutely. I always like to learn what's going on and what's new and exciting in the field that you're in. But tell us a little bit more about you and your background. And I always love to ask, when did you realize you wanted to delve into your industry that you're in now, psychiatrist?
Well, that's a great question, because one of the many hats that I wear is I teach at FAU's College of Medicine, first year med students, and so I a lot of times will ask them, like, so I know you just started med school, do you have any idea what you want to go into? Some already know, some are kind of figuring it out or thinking or not sure. So I tell them, like, yeah, kind of, I was in the same boat, that when I first went into med school, I kind of knew what I didn't want to do.
Okay.
So I knew that OBGYN I had no interest in,
Sure.
and general surgery I had no interest. I would say, I remember when I was a young kid, I had severe nearsightedness, so I'd always go to the eye doctor, so I always had an interest, maybe I'd be an ophthalmologist. Then I had perhaps some interest in anesthesiology, but then what got my interest in psychiatry was a few things. One, I remember as a first year med student, it was a behavioral science course. I was at the University of Illinois College of Medicine, and it was the preceptor, I still remember, Hyman Muslin, who was a Jewish psychiatrist. He was in the School of Self-Psychiatry, Heinz Kohut, but he had such a way with him and how he kind of talked about mental health and psychiatry that got me, interested. The other, thing or event that drew me to psychiatry was, my father, who's deceased, but he was dealing with a lifelong history of depression, and it got to the point where he needed electroconvulsive therapy, which changed his life.
Yeah. Are they still doing that?
They still, yes. Okay. It's very, very safe. It's this idea of what you saw in One Flew Over the Cuckoo's Nest is, it's not like that. So I would say that plus Dr. Muslin's effect kind of drew me to psychiatry. And then the third thing is that even still to this day, the brain is still kind of the most enigmatic organ in our body. I mean, we know everything about our heart, the lungs, the liver, the kidneys, but yet the brain, we're still learning about the different circuits in the brain and different functions of what this part of the brain does and what that part of the brain does.
It's fascinating to me. It really is.
We're still learning, and we're still, trying to understand.
Right. So where did you complete your studies?
So I did my medical school at the University of Illinois, and then my residency and fellowship residency in general psychiatry at the University of Maryland in Baltimore, and then
Nice.
my fellowship in child psychiatry at the University of Maryland. And then after I finished my my training, I moved up to New York, worked at a hospital-based job in New York, and then
In a psychiatric hospital, or
yeah,
right?
it was a private. It actually was a private psychiatric hospital in Westchester County called Four Winds Hospital.
Okay.
But then 9/11 happened, and
Yeah,
the weather
sure.
I was kind of getting tired of the weather. And then in the summer of 2003, we had the big blackout
Oh, I remember that.
that affected
Yeah.
like a good part of like the
I
Northeast and Mid-Atlantic. And just the reaction, people were freaking out, like terrorism and the whole.
Yeah.
And I was like, you know,
Yeah. You were done, huh?
I was like, I'm done.
Yeah.
So I was like, okay, what do people in New York, where do they look to move to? Florida.
New York South.
Right. So, and I'm like, I kind of got tired of the cold, gloomy winters, and I'm like, I want to go somewhere warm.
Well, we're glad you made it here.
So I moved down to South Florida and have been here since for 22 years.
And that's a real thing, though. People underestimate SAD, seasonal depression. I can testify that it's real.
Oh, I mean, it
It's-
is. I mean, it is a real, you know, illness. It's not something
yeah.
that's it's in your head.
No.
And I mean, it's in the DSM.
Right.
You don't see it as much down here,
Sure.
just because of you know the weather. I mean, our winters aren't gloomy and gray. We get sun for more or less the entire winter.
Yeah. Yeah. So that is a real thing. I know some people that had it. I was affected by it. That's why I couldn't wait to move down here. So I find it so fascinating. You get to treat children all the way up to adults. Is that right?
Correct. Yes.
Nice. And there's so many new modalities, right? And there's so many different things that are always changing and updating. I think you do a couple of things that are a little outside the box and different as far as treatments. You do the ketamine and then the TSM?
TMS, correct.
TMS, I'm
I
sorry.
mean, you're talking about like new modalities, new treatments. That kind of goes into what I was saying about how we're still learning about
Yeah.
the brain. And for example, just in the past, I'm going to say earlier this year, a new drug came out to treat schizophrenia.
Really?
That completely just different from
Okay.
the standard antipsychotics that have been used for decades. I remember when I was in medical school, you know, the idea of schizophrenia, the dopamine hypothesis, there's too much dopamine in the certain circuits of the brain that cause the symptoms. That's not really what we're learning. Is like, that's partially true, but like this new drug that came out, I'm going to say like in the spring, it doesn't even target the dopamine system, but has been shown to be very effective. And I don't treat many patients with schizophrenia in my practice, but I do cover on Sundays. I cover an adult inpatient unit at Fort Lauderdale Hospital, and so I have a lot of patients there with schizophrenia. And so I've been using this new medicine that's called Cobenfy, and I've been prescribing it a lot to these patients, and I've seen it do like amazing things. So it's just a new understanding of
That's good.
schizophrenia.
Yeah.
You're talking about ketamine and TMS. So ketamine, which is a dissociative drug that it's a party drug. People like to take it so they can dissociate and have these out-of-body experiences. But ketamine has been used as an anesthetic for 50 plus years.
Okay.
It's used a lot in kids as an anesthetic. It's safe.
Oh, okay.
And really does a great job. But there's a lot of literature also that has shown over probably at least 20 years that ketamine has rapid antidepressant effects.
Okay. Nice.
And it targets, so again, depression, the whole idea, depression is, it's too little serotonin.
Yeah.
I have a patient, it's a chemical imbalance. And it's much more complicated than simply too little serotonin or too much this. But ketamine, if you're going to like look at it from a chemical perspective, ketamine targets a totally different neurochemical called glutamate.
Okay.
Again, showing that, yeah, depression involves multiple neurotransmitter systems. It's not just simply too little this or too much,
Right.
too little serotonin. It really involves a whole multitude of different neurotransmitters. So ketamine, which is in a nasal spray, is FDA approved to treat what's called treatment-resistant depression. Patients who
Can they just self?
so no, it's an office-based procedure. Just because ketamine can cause changes in blood pressure and pulse, and if you
They have
have
to
this
be
out-of-body
monitored.
experience, right, you got to be monitored.
Okay.
So it's really an office-based procedure, but it's safe. It's also much more rapid acting than your traditional antidepressants.
So you give them therapy while they are.
So
how does that work?
So again, ketamine being, I'll use the term loosely, a psychedelic drug.
Okay.
Again, I'm using that word
Sure.
loosely, but so there is some rationale of also, and a few of my patients who I administer ketamine will then, like, I'll coordinate with their therapist that they go to their either the therapist will come to my office, or if the couple patients that I coordinate this, their therapist is in the same building,
Okay.
I'll walk them to their therapist's office and they'll sit there for several hours and undergo therapy while they're under the influence of the ketamine. Although the way the FDA approval doesn't state that, it has to be done in concert with therapy. It's just you administer the drug twice a week, monitored for a couple hours, and then go home. But
I would imagine the conjunction of doing the treatment as well as the therapy, I would imagine that would be more impactful.
it can be, and usually is, because in this kind of altered state of mind you're in,
Right.
you might be able to kind of discuss things.
Sure, be more open to
Right.
sharing and
You might have these like less resistance or less barriers
Sure.
holding back things. You could be a little bit more suggestible and
right.
And then the key thing would be after the treatment is like maybe the next day or a few days later have like an integration session where to kind of
Yes.
go over what was discussed and like consolidate that into your kind of ego, so
Yes.
to speak. So yeah, that's where ketamine comes into play. And then you mentioned TMS, which is transcranial magnetic stimulation. So that is a well, we'll go back to ketamine. It's indicated for what's called treatment-resistant depression. So
Okay.
patients who have, again, what's the definition of treatment-resistant depression? In general, I would say most experts would say patients who have failed at least two antidepressant trials.
Okay.
So ketamine is really kind of more for people with more treatment-resistant
Resistant,
depression
yeah.
or depression with acute suicidal
Oh
ideation.
wow. Okay.
Now, if I had a patient who says, like, I don't want to take Prozac, I don't want to take
Yeah.
Lexapro, I want to do ketamine,
Okay.
I'd be like, okay. I mean, I wouldn't have a problem. I would just say to them, like, if you're looking for your insurance to cover it, they probably won't, because
Right.
it's not indicated as like a first-line treatment. But
Got it.
if a patient's like,
Yeah.
screw my insurance, I'll just pay whatever it costs.
right.
Like, money's no object. I want to do ketamine. I'm not going to deny them
Sure.
that treatment. The same thing with TMS, which is a totally non-pharmacological treatment. So it's a device that consists of an MRI strength magnetic coil that you place in a particular area of your head, and it delivers these repetitive pulses, magnetic pulses that
Do they feel that or?
kind of feels like a woodpecker pecking on your head.
Okay.
And it penetrates about 1 inch into underlying cortical structures. And because the brain, like the heart, is an electrical organ, that the nerve cells communicate with each other through electrical impulses. There's a law in chemistry called Faraday's law.
We have a quick commercial break. I want to continue. Okay. This is good. We'll be right back, everybody.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to our show. We are interviewing, I will call you Dr. Gil. You can reach him directly at 561-300-4052. And the website is docgil, docgil.com. And he's right here, local, 7100 West Camino Real, Suite 404, right here in Boca Raton, 33433. And he is an adult and child psychiatrist, and I am really enjoying this conversation. I really love sharing, especially alternative modalities. And we were just finishing up with the transcranial. You were discussing the
magnetic stimulation.
Yeah. Can you share?
So the whole principle of TMS is the use of magnetic pulses to cause neurons in targeted areas of the brain to fire, and again, medication, antidepressants, or kind of does the same thing. I mean, antidepressants, they facilitate or modulate the effects of, say, serotonin, and then when serotonin binds to its receptor, it causes like these downstream effects. But medication has also more broader side effects.
Sure, this is
I mean,
true.
Like these SSRIs, like Prozac, bind, will cause serotonin to bind to its receptors for example, in the gut. Yeah. And so it causes like nausea and diarrhea.
Oh, yeah.
So I sometimes explain TMS versus medication to patients as like, TMS is like a laparoscopic procedure. Like, imagine back in the day, you had your appendix taken out, they'd open you up and take your appendix out. Today, they do it laparoscopically. It's
small
small incisions, and you could be at home the same day. Yeah. Back when I was in med school, they were doing an open appendectomy. Big scar, you're in the hospital for several days, you could wind up getting complications, you could be there for weeks. So TMS is a very targeted treatment, and it causes downstream effects by these magnetic pulses through the concept of Faraday's law.
What is that?
Faraday's law? The electromagnetic induction, that when you apply a changing magnetic field to something that conducts electricity, this magnetic field will induce an electrical current. So these repetitive pulses cause the neurons to fire.
Fire and wire, right? It
Right.
just starts
And
to act.
so-
It's
and
like
causes these-
stimulating that.
So it causes these same downstream effects as medication do, but
Oh.
instead of blocking reuptake of serotonin, it directly depolarizes or causes
Wow.
these neurons to fire. So it's a much more targeted treatment, and hence doesn't have these
Yeah.
kind of
Side
wide
effects.
side effects, like doesn't cause sexual dysfunction,
Sure.
weight gain, constipation,
Nausea.
diarrhea, headache, nausea. Yeah, maybe the TMS, when the coil sits on a
Yeah.
particular area, might cause a little scalp, like tenderness or headache, but that's
Temporary.
about it.
It's
Temporary.
Right? It's temporary, yeah.
Now, TMS it's a daily treatment. The treatment lasts about 18 minutes, and the recommendation is to do 36 treatments. So it is a commitment for about 7 weeks. So,
Okay.
but you could. It's an office-based procedure, but you can come in, have the treatment, and go about your day. You don't need, unlike ketamine, where
Yeah.
you got to be monitored. You,
Sure,
you
you
sit
have
in you sit in this chair for 18, 19 minutes, and then go about. Like, hey, I have a lunch break. Can I do my TMS during my lunch
Yeah.
break at work? I work 5 minutes away. Yeah, sure. Or
Nice.
Can I
So
do it-
every day for 7 weeks, you saying?
Monday through Friday,
Nice.
typically.
5 days a week. And I'm sure there's a lot of great research as far as results.
Yeah.
Can
So
you share with us some of those results?
So I know that there's about 5 or 6 different TMS devices out there.
Okay.
I think they're all equally good.
Okay.
I don't think one's superior than the other. Obviously, if I was working for one company, I'd say, "Oh, my product's the best."
right.
But I think they're all equally good.
Okay.
I've used the NeuroStar device and the BrainsWay. I know with the NeuroStar, the data shows that 1 year there's about 83% response and like 62% remission
Wow.
after 1 year, which is pretty good.
Does it help with anxiety too?
So-
or is it targeted just for depression?
So here's the other thing about TMS. At least I could say the NeuroStar and the BrainsWay machines are FDA cleared for major depression, usually treatment-resistant depression, and OCD.
Oh, wow.
There,
Nice.
There is plenty of data that TMS is also effective for like generalized anxiety disorder, post-traumatic stress disorder, ADHD, chronic pain,
Okay.
tinnitus. There's all
I
these.
figured it would have
there's all these
other.
The only
Right.
problem with some of these other uses, called off-label uses,
Sure.
that there are no set, like one established protocol.
Mm-hmm.
Like, for example, today, in one of the, I do TMS, there's a clinic in Delray that and the medical director and I'll go over and do TMS for them. So the clinical director we have a patient who wants to do TMS for Alzheimer's,
Oh.
but I said, well, there are some studies, again,
Okay.
it's not an FDA cleared indication,
Sure.
but there are some studies, and you read these studies, they're small sample sizes, but they have all these different protocols. It's not like, the coil's placed on one, some of the studies
Yeah.
were placed here, some were placed
Sure.
somewhere else. They're using different amount of pulses, different amount of treatments. So the only problem with when you use TMS for off-label indications is there may not be set
I see
like
what you're saying.
protocol as there is, say, for depression or OCD.
Right. Right.
But does it mean that
It's hopeful. It's
right?
hopeful
Does it mean that
for these-
TMS can't be used? No, it's just like when I get these type of cases, I'll want to do my research and say, okay, this is probably the best
I see. Yeah.
protocol to use based on the studies or amount of patients in the study or what the outcome was.
It's really promising to know that technology is evolving and it's changing so rapidly, and we live in these times where there's other,
Right.
other modalities.
Right, I mean, you go back, 20, 30 years, it basically was older medications that had a lot of side effects. Even,
Yeah.
the newer medications we have have less and less side effects, but
Right.
there are some patients who don't want to take medications.
I know.
Can't tolerate medications.
Yeah.
And, even ECT or electroconvulsive therapy is safe and effective and is an option. We have the TMS, we have ketamine.
Sure.
Down the road, just a matter of time when we have other psychedelics such as
Yeah,
psilocybin and MDMA that are in, last summer, Lykos Pharmaceuticals had their MDMA pill that the FDA rejected, claiming there was not enough safety data, which I thought was was a kind of.
We're going to have to invite you back to continue this conversation because I cannot believe the time has already. We literally have 1 minute left. So, would you like to share with our audience in 30 seconds any last call to action or whatever you'd like?
I would just say the field of psychiatry is it's more than just to take a pill to feel better.
Right.
That there are newer modalities available, and that
I love that.
that basically allow us to attack these debilitating mental illness that maybe 10, 15 years ago could have been much more difficult to treat. That I'm not saying it's still not challenging, but
Sure.
there
Are more options.
Yeah. In our armamentarium.
Thank you. All right, I'm going to give you your location again. Please, everybody listening, reach out to Dr. Gil. His number is 561-300-4052, and he's right here, 7100 West Camino Real, Suite 404, right here in Boca. Thank you, everybody, and we'll see you next week. Take care. It's a pleasure.